Hi guys, I'm Charity with Nurtured Baby, just checking in with all of you. I wanted to give you guys your weekly tip. I know it's towards the end of the week, but I had a really bad migraine on Tuesday, and if anyone's had a postpartum migraine, they are not fun. But speaking of pain, I'm going to be going over a quick teething routine today. So I have my little friend here with me today. I'm actually going to scoot a little bit closer. And again, we're just talking about teething, which can actually start at 3 months and go all the way up to like 2 years when you're talking about the molars in the back. And it can be obviously pretty painful. I know some of you have already gone through this, and it is a roller coaster for sure. So one of the things that we're talking about is releasing oxytocin. Now, many of us think about that when we think of the love hormone. And when we talk about massage, we talk about it a lot because it does bring out that love hormone, but it's also a pain relieving hormone as well. So that's one of the things that's incredibly beneficial when we're talking about massage. It doesn't just help with the love and the bonding, but it also helps with bringing out the oxytocin for pain relief as well. Now, whenever we're coming up towards the face, that can be pretty intimidating for a baby. I'm just gonna set her right on my knees. And that can be really intimidating, as just going directly for the face. So you kind of want to just ground yourself. I've talked about that a lot. You can hold their hands, just let them know. And then you can kind of put your hands to the side of their face. Now, you don't want to cover their ears, and you don't want to really place your hands like directly on top of their head with pressure. So you're just going to come to the side of their face, just like here, and just a tiny bit of pressure through here, just letting them know. You can kind of talk them through this. And then from there, you can kind of do some strokes through here. It can be pretty painful when they're biting down on things. That's where some of the pain comes in, is this muscle right here. When we get tooth pain too, that generally happens to be through here. For those of us who grind our teeth, it can come through here as well. So definitely massaging through the jaw is extremely helpful. And I just do like tiny circular motions with like 2 fingers. So you can do that here on baby as well. Now, depending on how little your baby is, you could even just do 1 finger at a time. Make sure your nails are nice and clean, but also cut short, because you don't want to be stabbing them with your nails. So unfortunately, I can't get my nails done right now, so they're just butchered super short. But yeah, just right through here all the way down. So on her, it's going to be right here and then down the chin, just like that. And then you're going to come over to her lips, and you're just going to make like a smile up this way, starting at the middle of the lip and coming up, starting at the middle of the chin and going up. And then you can do small circular as well. Depending on the size of your baby, you can use 2 fingers or just 1. You can work on one side at a time or both at the same time. Now, keep in mind they're probably going to be a little bit squirmy because it is their face. So until they get used to this sequence, they might be a little bit squirmy. Just be patient with them. But again, we're just really talking about the jaw, and then through the chin right here and above the lip. We're trying to get all of that nice and relaxed. The only other thing that I can think of is oil. When we talk about oil, I know some of you might be thinking, well, with oil, this can be really red when it comes to teething. Do I add oil? Do I not? How much? So that is one of the reasons why we always make sure to use a vegetable-based oil, whether it is coconut or the sunflower or the jojoba oil. Any of those, perfectly fine. You just want to use a very small amount so you get that glide. You don't need to use an excess amount at all. Just enough to get a glide. It's perfectly fine as long as there is no broken skin. Once you have broken skin, then it becomes a contraindication. So, but most of the time you don't see that when you're talking about teething. It's just kind of red or bumpy. If it's just from the teething, again, it's completely fine. It's not a contraindication. You just want to use a tiny bit of oil, just enough for that to glide. Other than that, that's it for today. Let me know what you guys want to know next week, and I'll make another video for you. Bye. Bye.